Hello everyone, excellent evening everyone, excellent evening to every one of us. Well, highly welcome to this evening's broadcast. Welcome. How are we doing? Today we are looking at the remaining 35 symptoms of menopause. Okay, so last week we looked at the 35 symptoms of menopause and we looked at ages 40 to 50 mainly. Okay, most of the symptoms that are affecting ages 40 to 50. Today, we're looking at the remaining 35 symptoms. Remember, we are dealing with 70 symptoms of menopause. And there is a book that will be coming out next week. Okay, next week we're going to be looking at the postmenopausal women. Okay, what you have to do, because it's not just about perimenopause, menopause. Postmenopause is where we are all going to, by the grace of God. We'll all get there. Amen. Okay, so remember that in Aging with Grace, we're in TikTok, Aging with Grace, YouTube, Aging with Grace. So feel free to follow us. Today, like I said, we're looking at the remaining 35 symptoms. Stay tuned. You will learn a lot from today. Menopause, like I said, is a natural process that affects millions. In fact, it affects many women, almost every woman. It's only a few women that don't even know what menopause is. Not that they don't go through it, but they just don't see my hair. 4 inches or more. I'm going to 5. All right, so many women, it's not that they don't go through it. They go through it, but they don't have symptoms, so they don't really realize it. Okay, so and that's the thing with menopause. But as for menopause, it happens to everybody. Remember the stages of menopause. Pre-menopause is when you are in your biological age, where you're still having children. Okay, everybody's biological. Then perimenopause is that transition period between pre-menopause and menopause. And then you now have the menopause and you have the post-menopause. So during perimenopause, levels of estrogen start to decline, and you may have all those symptoms of menopause that we're going to be talking about today. Remember, we handled 40s, below 40s to 50 last week, so you can go and watch that video. It's still there on Facebook, on YouTube. Okay, and we've done the shorts in Instagram and in TikTok. Okay, most women will experience symptoms of menopause, more than 90% of the women, and many will experience it early symptoms at the early stage of menopause. And menopausal symptoms can begin months, even years before you enter the menopause. Some people it's a few months, some people it's up to 5 years, some people 7 years, some people 14 years. I'm telling you, they go through it. Let me say, my own lasted like 10, 11 years. Yeah. Okay, so it was quite long, but the good thing was that I had it under control. All right, so if you go through the menopause because of surgical or medical treatment, then you definitely will just experience the symptoms immediately. And I'm concentrating on ages 50 to 60. Okay, next week we're going to do 60 and above. Ages 50 to 60, many people are now about to enter the menopause, really, and then transiting from menopause to post-menopause. Okay, next week is going to be very, very interesting, because we're going to be looking at some of the symptoms and why they persist onto post-menopause, and what you have to do now during your perimenopause and menopausal season to make sure it doesn't transit with you to post-menopause. Okay, so one of the things I've had a lot of people complain about during these ages 50 to 60, and some people complain about it during post-menopause. We're going to be talking about this particular issue next week also, because it's one of the things that transit with women into post-menopause, and that's urinary incontinence. Okay, urinary incontinence is also known as loss of bladder control or involuntary urinary leakage. Now, millions of women experience it, and the frequency of urinary incontinence tend to increase as you get older. That's why I'm saying it's one of the things we have to talk about during postmenopause. Okay, so the loss of control can be very minor for some people. For example, you might only leak a few drops of urine when you laugh, or when you exercise, or when you cough, or when you pick up heavy, when you're carrying load, you just find out that urine just leaks. Okay, or you might even experience a sudden urge to urinate, and yet you're unable to keep it before getting to the restroom, resulting in that accidental leakage. Okay, sometimes you're not even feeling like urinating, but it will suddenly come, and immediately it comes, you find out that before you even get to the toilet, it's leaking. So some of those symptoms, you know, are like when you're exercising, it's coming out coughing, it's coming out laughing, it's coming out sneezing, sometimes it's coming out, okay, and you have that urge, like I said, but you can't just keep it until you get to the urinary place. So what do you do? What are the remedies? Empty your bladder before physical activities, and then if you're planning to exercise or do any physical activity, go to the toilet and empty the bladder. Sometimes even if you're going out, or you feel like you've stayed for some time and you've not emptied your bladder, just go and sit in the toilet and empty it, okay? And then avoid carrying heavy loads at this age. Let people help you, or you ask someone, come and help me. And if you need to actually do some exercise, like I said, make sure you urinate before 10. The second symptom, remember we're going 35, I'm going to be faster very, very soon. Okay, the second symptom is urinary tract infection, UTI, okay? And this infection is a type of infection that involves your urethra, your you know, and your kidney, your bladder, and so on. So some of the symptoms of UTI is pain in your lower abdomen, okay? Near that bladder you will have pain, pelvic area or your lower back. Sometimes when you're having lower back pain, it's not arthritis, it might be UTI that is causing it. Sometimes when you're having pain in your bladder, it might be UTI, okay? And again, another symptom will be pressure in your lower part of your pelvis, okay? And sometimes you have this smelly wee that is a little cloudy. Those are the symptoms. So what do? You need to have a good habit of good hygiene. Practice good hygiene. Practicing good hygiene is one of the best ways to prevent UTI, and this is especially important if you have a vagina, of course. We women, that's what we are treating, because your urethra is much shorter and it's easier for E. coli to move from your rectum back into your body. So always wipe. Now if you go to the toilet, how do you wipe? Don't wipe from back forward. You know, sometimes when people are sitting, it's easier for them to wipe from back forward. Please wipe from forward backward. That's the best way to wipe when you go to the toilet. And again, there's one hygiene that is very good. You can use water. Use water anytime you go to the toilet. In fact, what I've done practically for my bathroom, in the house, I use one bathroom, my own or my husband's own, in my bathroom or in his bathroom. And what I've done, I've put the that hose with a pipe that can just pump for you to clean up when you wee-wee. So when you wee-wee, first of all, use that water and splash over. If you still want to use your tissue, you can use your tissue, and you can maintain a wipe, okay, that you can use to wipe off when you finish. It's very, very good. But remember, from forward backward, don't clean from backward forward. This will help you. And then take plenty of fluid. Take plenty of water. Water is very, very important, okay? Water each day can help to flush out bacteria from your urinary tract. And okay, and it's very, very good for you to take enough water. We've already handled water and how much water you can take. The third symptom is vaginal infection. Remember, we treated urinary incontinence, UTI, urinary tract infection. The third one is vaginal infection, okay? A vaginal yeast infection is a type of fungal infection, and your body contains a kind of yeast called candida. Everybody has it at a certain level, okay? And this is what actually causes vaginal yeast infection. Yeast is a type of fungus, and candida is a specific type of yeast. And when the yeast is not balanced in your body, then there is a problem. We all have it, but it has to be at a good balance. It's just like your colon, okay? We have bacteria, we all have bacteria in our colon, in our gut. But when the balance is not good, that's when it becomes, very, very bad. Even the H. pylori they are talking about, everybody has a bit of it. It's when it becomes so much that it overpowers the good bacteria that it becomes an issue, okay? So symptoms of vaginal infection is itching or burning sensation in your vagina or vulva, a thick white vaginal discharge with consistency looking like cottage cheese, redness, swelling of your vagina or your vulva, and then small cuts or tiny cracks in the skin of your vulva area because of the fragile skin. That's what happens. So what do? One thing you must stop doing is douching, okay? Because when you douch, you the bacteria in those places, it will remove the good bacteria, okay? It will kill those bacteria that will control the fungi or the fungus in the system, okay? And that is not good. So, and then avoid using all these feminine deodorants. They talk about using deodorant on those under places. It's not good. If we must use deodorant, like we have our shield deodorant that is very good to remove all those dark places on your laps. Don't let it go on your vagina, whichever one it is, okay? And then also, some people, when they are buying tampon, they're looking for scented or perfumed tampons. Sometimes those perfume can actually make those fungus to grow more. So you need to be very, very careful, okay? Change wet clothing, okay? If you're wet, especially when you're having discharge, you can get panty liners. You can change your pants more than 1, 2, 3, 4 times a day, depending where you are, okay? If you're in places where you're not, you can have disposable pants. Okay, that's another means. Have disposable pants. Okay, you put them in your bag and you can change them from time to time. Have panty liners, change them. Make sure you are not wet there. Okay, and then don't wear clothes that will make you to sweat there. Number 4 is stroke. I know a lot of women will want me to spend more time there, but let's just call it a day on that side. Number 4 is stroke. Stroke is a disruption of blood flow to the brain. You can ask your questions. I'll answer your questions, okay? I welcome all of you. Hello, Annie. Edging with Annie is here with me. Hello, Anne. How are you? Thank you for joining me. That's one of my mentors. In fact, I think Anne is one of the oldest one. How are you? Thank you for joining me today. And Abigail is here too. That's another of my mentors. Oh, wow. You guys are here today. So, like, I have 2 of the people I'm training to use their talents, their hobbies, you know, their abilities to work from home. These women I mentioned here are making millions from home. And I'm training them, okay? We all work from home and I train and mentor them and we rub minds together and we grow together. All right, so stroke is another symptom of menopause, especially 40s to 50s to 60s, okay? The symptoms of stroke can come suddenly without warning. Recognizing stroke symptoms is very, very good to seeking treatment quickly, and it can lead to better outcomes. So some of the symptoms is paralysis. When you begin to feel a little funny in your hand, be very, very careful, or your leg or some parts of your body. Okay, numbness or weakness of the arm, the face, the legs, especially on one side of the body. Okay, hemiparesis is very, very important for you to be careful about it. Then double speaking or you know, trouble speaking or not understanding people is another symptom. Slurred speech, when you begin to notice that your speech is slurred, you need to be very, very careful and do something about it very fast. Okay, confusion, disorientation, lack of responsiveness, sudden behavioral changes, especially increased agitation. These are some of the symptoms of stroke. So what are the remedies? Brain boosting natural foods, very, very important for you, okay? Food can play a very, very vital role in promoting stroke recovery if anyone has it, and also preventing stroke. In fact, studies have shown that consuming energy boosting and protein rich foods especially for people who are developing stroke, is very, very important. It can help to, you know, bring greater independence because it helps a lot, okay? Now, there are brain boosting foods that you can take, and some of those are Active C or omega-3 fatty food that are rich in omega-3 fatty foods, okay? Blueberries are also very, very good if we're talking about greens, and green leafy vegetables are very good. The 5th symptom is irregularities in heart rate. It may feel as if your heart has just done like boom, boom, you know, skipped a bit and things like that, okay? That's also one of it. That irregularity is not palpitation, but you can just stay on your own. You will just have that boom, 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 and then that is it. You might not have it again till the next day. It's a sign of perimenopause, and you need to be very, very careful about what you're eating and things like that. Hello, Justina Abu, good evening, you're welcome. Welcome to this evening's broadcast. Nabuchi Okonkwo, welcome, good evening, you're welcome. So number 6 is heart disease. Menopause perimenopause could increase your risk of heart disease, especially between 50s and 60s. Okay, so if you're a woman and you're going through menopause, changing your hormonal levels can make your heart pound or flutter, and a pounding or fluttering heartbeat, or that is now palpitation, is often because of hot flushes. It comes mainly because of hot flushes that are not controlled. And remember, we treated hot flushes last week. Hot flushes is another symptom that happens to both 40s to 50s and 50s to 60s. Okay, it can even go over to after 60 to post-menopause. You need to be very, very careful. And I already showed us the supplement that can help you make sure you control hot flushes. It's very, very important. I tell people one thing about hot flushes: it looks as if it's nothing. It's not painful, in quotes. It's not really very disturbing for some people, but it leads to post or secondary diseases. And some of these things we have mentioned are some of the secondary diseases that come with palpitation. Heart diseases, okay, is one of them. Stroke is one of them. Irregularity in heartbeat is another thing that is a secondary disease that comes from hot flushes or night swell. So you need to be very, very careful about it. Okay, during menopause, level of estrogen level rises and falls. It's very, very erratic, and by the end of menopause, your body will stop producing this hormone. Changing your estrogen level can now often lead to heart palpitation. So women who are experiencing palpitation during other times, like pregnancy period, some people also when they're having very serious hormonal imbalance, even in their 30s, they have not reached menopause, they can still have all this heart palpitation or heart disease. Okay, so sometimes it comes suddenly without a warning, without provocation, and you don't even know what causes it. It will just come on you. So the experience can be so wild and intense that a woman may become alarmed and wonder if she's about to have heart attack at times. So it's very, very important that you do something about it. So some of the things you can do is deep breath. Okay, make sure you practice deep breathing. Make it as a routine. And also meditation. Like I told us today I was on bed. I woke up, I did not even get out of bed till 4:30. I only went to wee. And at a time I became hungry. I said, I'm not going to that kitchen. I just mixed Aji and Super Green right there on my bed. Okay, I took water from my fridge in the room. I mixed Aji and Super Green. I took some groundnuts. And I took groundnuts and that drink. I said, I'm not getting up. So sometimes you need to keep away and then meditate, okay? And then you can do massage. Like I told us, by the time I came out, make sure I rounded my office and went back, I went and did some jacuzzi massage, water massage, very, very well on myself. Okay, so all these things are good for us. And you stay away from caffeine and alcohol. We're talking about things to remedy heart diseases, palpitation, and things like that, okay? And then some supplements can help. Like I showed us last week, Active C is very, very good if you're having palpitation. Garlic thyme is another very good one if you're having palpitation. And of course, our popular aloe vera gel, or better still, beets and peaches, because this will help to cool your nerves. Very, very good for you. The seventh hey, time is going on. The seventh symptom is osteoporosis, loss of bone density. Okay, that's osteoporosis. Okay, it is not only an elderly woman's disease. It seems to develop over an extended period, and it is actually triggered by decline in your hormone production. So postmenopausal women are susceptible to primary osteoporosis, since osteoporosis is closely related to also estrogen deficiency. So that's one thing you need to be careful. We're going to be talking about it again next week. Okay, osteoporosis is one of the things that follows people to post-menopause. So you need to handle it now, and handle it very, very well. During menopausal transition period, that drop in estrogen will lead to more bone resorption than formation, okay, resulting in osteoporosis. So estrogen level drop around that time of menopause, which occurs at the average age of about 50 years. That's why I'm talking about 50 to 60, will result in that increased bone loss. So if your peak bone mass before menopause is less than the ideal, then any bone loss that occurs around menopause will result in osteoporosis. Very, very bad. So what do? Eat more vegetables, green vegetables in your diet. 75% at this period if you want to come against it. It's not the one I tell you 50, 25. At this period, if you're having issues with osteoporosis, you need to eat 75% of vegetables, okay? And make sure you get our forever calcium. Very, very important for you. Even if you don't have many of the supplements, make sure if you're having issues with osteoporosis, get our forever calcium. And of course, our absorbent D. Mine is coming in tomorrow. I've ordered for 4 for myself and my husband. Is coming in tomorrow. So get your absorbent D. Very, very good also, because it's rich in vitamin D and vitamin E, okay? And make sure you maintain a good weight. If you're overweight or obese, it can cause osteoporosis. Number 8 is hot flushes. I don't want to talk too much about it because this one is very common for everybody. I've even done a video on hot flushes. You can go on my page and look at it. Hot flushes is in 40 to 50, 50 to 60, and some people it follows them to post-menopause. We might still talk about it tomorrow, okay? I've talked so much about it and the remedies. Number 9 is being accident prone. If you've noticed that you started bumping into things and not even realizing it until you bruise yourself, and then later you realize that, oh, where did I get this injury from? You just find out that you bruised yourself. You're asking yourself, who cut my hand? I can remember one woman, she was saying that they came to cut her hand in the dream. The witches are doing that. No witch, oh. It's just being accident prone, okay? At this 50 to 60, that's one of the issues, okay? You might not be able to recall how you got it, and sometimes it gets so scary for you that you're not even you're wondering, how did this one come? So what do? You need to slow down. Some of us are still moving. I'm talking to myself. Some of us are still moving at the pace of 25 years at age 50 to 60. We are nearly 60 and still our speed is as if we are 35 years old. Number 9 also, I talked about bumping into things, and then I now said that it's not witches. You need to slow down. That's one thing you need to do about yourself. Slow down. Then abdominal bloating is another thing. You just find out that there is gas in your abdomen, okay? It comes on suddenly, often after eating, or even after a while that you have eaten. Sometimes it's so visible that you can see, you wonder, is it this small thing that I've eaten that is making my stomach to be big, like as if I'm pregnant? It's stomach bloating. It comes with with perimenopause at the later stage of perimenopause, 50 and above, okay? So what do? One thing that will help you is our probiotic. I take my Pro-B every morning. Pro-B and Fields of Green will help to remove bloating for you, okay? Then number 11 is fluid retention or edema. Edema is a common swelling in your legs and ankles, though not limited to this area, but it's also unrelieved by urination. Even if you go to toilet, you wee, you still find out that it's there. Sometimes you lift your leg, it goes down a bit. By the time you do a little walk, it comes up again. Edema is part of menopause, especially at the later part of menopause, okay? So you need to take diuretic food, like add more turmeric, ginger, garlic to your food. And also you can get a forever garlic thyme. If you don't like the smell of garlic in your mouth, it will actually help you. And then aloe vera gel is also very, very good. The 12th symptom is tendency towards candidiasis may increase, okay? It may increase. Hello, Give Jonathan, good evening. You're welcome to this evening's broadcast. We're looking at the last 35 symptoms of menopause for ages 50 to 60. Remember, we looked at the first 35 for ages 40 to 50, and next week we're going to be handling 60 and above, okay? So even if you have a prior history of candidiasis, you will notice that during this period it will increase, and that's why you need to be extra careful. And that's why I'm a supporter and advocate of Vitalized Women. Get Vitalized Women, take it religiously, and add your B propolis tablet to it if you are prone to candidiasis, okay, or all those fungal and bacterial infection. Your Vitalized Women and your B propolis will help to make sure you're free from all this. Number 13 is gastrointestinal disorder or distress. Decreasing amount of estrogen and progesterone during menopause can slow down the process of food passing through your gastrointestinal system. When the digestive process takes longer, more water is reabsorbed back into your bloodstream. And when this happens, it leads to constipation, which is increased gas and bloating. It's different from bloating after eating. This one is a matter of food not digesting well, okay? So what do? Exercise will help a lot. Aloe vera gel will help you, and of course, Pro B. You will notice that there are some supplements I'm mentioning often for us at this age, 50 to 60. Probiotic, vitalize women, aloe vera gel. Let me get my aloe vera gel. They are very, very important for you at this stage. Okay, I'm mentioning them. And then fiber. Any food that can give you fiber. If you're the type that you don't like vegetables much or food with fiber much, then buy fiber. We have our forever fiber that can help you. Hello, Lua, Somi Dotto, Fumilayo. Thank you for joining me. And then reduce stress. Do you know that stress controls the way your food digests? Yes. I'm part of those who need to reduce stress. I'm telling myself so. That's why I took out today in the morning. Waking up till 4:30, I didn't get out of that bed. Okay, we need to distress. Stress management is very, very important. Very, very important for us. Okay, another thing that could happen to us at this age, we are all there, 50 to 60. Some of us are nearer 60. Is slow digestion. Okay, it often goes along with the bloat that we previously mentioned. Okay, sometimes the food that will take you 4 to 5 hours to digest, now you can eat that food by 7 p.m. By the time you're waking up early 7 a.m., you're still wondering, did I just finish eating? Because you have one kind of acid reflux or something that is doing as if the food is still in your system after 12 hours. This happens with menopause, perimenopause, at this later stage. And that's why, again, I say Pro B is one of the things. And Pro B is once in the morning. When you take it in the morning, first thing in the morning, it will help to control your gut bacteria up until, later in the day. And of course, aloe vera gel does wonders. Don't want to talk too much about this, but this is the highest selling product in my company. Aloe vera gel, and I mean every country and all over the world. Even if you can't afford any product, buy aloe vera gel and make sure you take your aloe vera gel all the time. Okay, then number 15 is lack of appetite. Okay, some people have constipation and bloating and overweight, but some people have lack of appetite. Okay, they find their appetite gradually decreasing, and it's so common during perimenopause and menopause for some women. Okay, and it's actually sometimes very difficult for them to resolve. Okay, what are the symptoms? Feeling full after eating only very little amount of food. That's one symptom. Having bloated stomach is another symptom. Feeling nauseatic or having other symptoms of indigestion like heartburn, acid reflux, stomach upset, feeling fatigue and weak, having trouble concentrating or focusing, or experiencing some kind of brain fog. These are all symptoms of lack of appetite. So what do? Change your eating pattern. Okay, rather than eating so much at a time, share your meals into some bits. Okay, this is particularly for those who are having that lack of appetite. Okay, so when you eat a little and you're getting full, you stop. Split your meal into 5 to 6 times a day instead of eating the 2 to 3 or 1 to 3 that is recommended. Also, you can add some healthy snacks, healthy fiber-filled snacks. Okay, when you're feeling hungry. And then another thing you need to do is identify and treat underlying digestive problem. So if you're eating an anti-inflammatory diet, okay, it will help you, like vegetables, like I say, fruits, healthy fats, they can help you. Get your Active C also, it will actually help you. And nature mean is another thing, and of course aloe vera gel that can help you if you're having lack of appetite. Change in body odor is another symptom. And because your sweat glands, the sweat glands that regulate temperature and cool you down during perimenopause and menopause, that thermoneutral zone, that is the zone where you neither feel too hot or too cold, is reduced. Okay, and then your body now reacts by sweating at lower temperatures and making you shiver at higher temperature than normal. So this is why you sweat more during menopause. That's because of this. So, and then what comes with it, some of the things you need to do is to wash your body regularly. Have your bath at least, and I mean at least 2 times a day. But if you come back from work and you're sweating a lot, go and have your bath before you go to make dinner. After making dinner before you sleep, have your bath again. Have good soap. If you have good soap, you won't be thinking about losing so much oil, okay? Avocado soap has avocado oil. Very, very good for every woman at this period. The perfume is not so wild, but what it does for you is that it makes sure that you remain cool throughout. So you can have your bath 3-4 times a day with avocado soap, and you won't really feel that you're losing oil. It's very, very good, okay? So sometimes that unpleasant odor is people are very, very sensitive to it, and you're not able to, people will be dodging you. You will know why people are dodging you. So it's very, very good. And then another thing that can help is also coconut oil. If you take coconut oil on your skin, natural coconut oil, it will help you also, okay? The next symptom is symptom 17, which is puffy eye. Some people have these puffy eyes, okay? Not only from sleep disturbances, but also from low progesterone. You can have puffy eye. Puffy eye is caused by low progesterone. And with lowered collagen production, blood flow, cell turnover rates, and increased water loss, menopause often leads to thinning of the skin. And this can actually cause lines, wrinkles, dark circles are more pronounced, okay? So what do? Make sure you take your collagen, okay? Your collagen, infinite firming collagen or marine collagen. Those of you who need marine collagen, begin to order, because I'm traveling. I'm going to be sending marine collagen from Canada or US to you, okay? So order now your marine collagen to get it. Very, very important. Or you get your infinite firming complex. These are very good for you. So apply cold compress. Anything cold can help with inflammation and swelling, and it reduces blood flow to that area, okay? So a cold compress with an ice pack, or you can actually put some, maybe if you have some drinks or smoothie in the fridge, you can bring it out and use it before you start drinking them. It can help. Or you can also refrigerate your spoon. You put your spoons in the bag, and then you bring out the spoon and you use it to press all those parts of your body. You can also use cucumber slices. You can actually also use cucumber slices to treat it. And then we also have our awakening eye cream. Awakening eye cream can also help you. And of course, if you take your infinite firming complex, it will help to build up your collagen and not allow it to happen in the first place. Number 18 is facial polar alternating with facial flushes, okay? This is often intermittent with hot flushes. So it comes with hot flushes. So whatever remedies you do for hot flushes, that's what you also do with facial polar, okay? Number 19 is arthritis. Now, in 40 to 50, we treated bone pains, joints, and whatever. That hadn't reached arthritis. It's still wear and tear, small. By the time you now enter 50 to 60, it's now confirmed arthritis, because for some people it has stayed for some time. So you have aches, stiffness, swelling around the joints. Sometimes they feel warm, okay, and they get worse in the morning, improving during the day. Larger joints such as your hips, your knees will experience higher impact and more prone to arthritis, okay? So natural remedies, add drop spices, especially if you're not having hot flushes, okay? Turmeric, cinnamon, ginger, garlic, flaxseed can help you. And of course, stretch exercises, and of course our wonder supplement Forever Move. This is turmeric and eggshell in capsule. Miracle supplement. I tell you, it has taken a lot of people out of arthritis. Number 20 is hair, dry hair, skin, change in your skin tone and integrity and texture. You can see my face and my skin is still very plumpy, no wrinkles, and it's because I'm working on myself. Some of us will spend so much money on clothes, so much money on furnitures, and this body that we wear the clothes, and this body that we use the furniture, you're not spending money on it. Get your infinite firming complex, get your marine collagen, get your royal jelly, okay? Because if your skin becomes more wrinkled, it will begin thinning, and if you don't handle it on time, it can get worse. Do you know that Nature Mane, our supplement called Nature Mane, can help in giving you fuller hair. It can help in your hair having fuller, not thinning out and things like that. It can help with your skin tone, just like Infinite Feminine Complex. So take a lot of vitamins, okay? Vitamin A, vitamin C, vitamin H, minerals, macro and micro minerals. That's why I mentioned Nature Made for You, okay? Then number 21 is changes in your fingernails, which is characterized by breaking, bending, cracking, and getting softer. These are also some of the perimenopausal, late perimenopausal symptoms, okay? So at first glance it seems strange that you're going through menopause, and it could cause all these things that are happening to you, okay? So but because of that hormone of your estrogen fluctuating, that's why all these things happen to you. So applying nail hardener, that's what some people do, can help. But collagen is another thing that can help you, okay? And then get moisturizers, okay? If you have dry nails, you can actually use moisturizers on your hands and fingers. All those moisturizing cream. We have one called deep moisturizing lotion. Get deep moisturizing lotion. Always put it in smaller containers and you put it on your hand, okay? If you increase the moisture, it will help your nails to become less brittle. Number 22 is muscle tone. Your muscle will become slack. You find some women here, when they raise their hand, you will just feel this whole place is so tight. Is another symptom of perimenopause at that 50 to 60. Loss of muscle tone refers to a condition where muscle reflexes are absent, hyperactive, normal, and hyperactive, okay? So it's because there is severe disease of malabsorption syndrome or metabolic diseases leading to weak hypotonic muscles. It even happens in some children also. So what do? You need to take more protein. If you're having flabby skin, you need to take more protein. Adequate protein intake and exercise will help to reduce muscle inflammation, and that's why our light ultra is what you need, okay? And the good thing with this light ultra is that it helps with protein, and it's a protein shake. You can take it as many times as possible. It digests very fast. It has all the vitamins that you need. It's very good for you. Number 23 is pelvic pain. You begin to find out that it's not that you're having arthritis. It's not that you're having pain anywhere, but your pelvic, you feel peppery, you feel pain. So during perimenopause, your pelvic floor becomes weaker. Sometimes it's caused more than one of your pelvic organs to drop or prolapse, okay? And this could actually also lead to lower abdominal or pelvic discomfort, and often with heaviness or dragging there. So what do? Exercising is very important. Keep moving, keep activities, take the heat, make sure you increase blood flow to that area. It's reduction of blood flow that makes all those places to relapse. Sit in bathtub full of warm water and provide relief for yourself. Every evening, if you can afford it, sit on a bathtub for like 30 minutes before you get up and have your bath, okay? It can help you. You can also use some bath pad, hot, warm or heating pad in those areas, just for blood to flow. It's because of lack of blood flow that such things happen to you. Then teeth aching. Do you know that teeth aching is another symptom of later age? That's why you find elderly women begin to talk about their teeth aching, them having gum issues and things like that, okay? It's another symptom of 50 to 60 and above of perimenopause. It's very crucial for us women to be aware of menopausal issues related to our dental health, so that we can take adequate steps and be prepared for them. At this stage, it requires diligent oral care to prevent lasting teeth damages, and if they damage, they are very difficult. So you have to minimize your risk of tooth loss during and after menopause by maintaining an excellent dental hygiene. Brush after meals, and you can use very good toothpaste like our Aloe Bright Tooth Gel. It has natural aloe gel and propolis in it. Very good for you. And then you can use your dental floss also, so that you can remove things from within your teeth. It will help you a lot. Number 25 is changing your normal tongue sensation. God will help you today. I must get to 35 before my time is up. No more greeting, though. Josephine, you're welcome. Oh. Burning tongue in menopause refers to a very, very painful symptom characterized by a burning sensation in your tongue. In your mouth. I've had a lot of women, also a few women, complain about this. Okay, it could include the burning sensation in the roof of your tongue, your gum, your lips, the side of your mouth, the back, like two thoughts, and tip of your tongue. Most commonly are affected. There is a partial or complete loss of taste or changes in your ability to taste sweet, sour, bitter, salty taste. Okay, and there sometimes they have difficulty in moving their tongues because of that pain, and some women, their own grows into tongue swelling. So a change from the normal color of your tongue to or patches of color that are white, bright pink, black, and brown. Pain either all over your tongue or in certain areas of your tongue. This is some of the things that happen with tongue sensation. Tongue sensation is a menopausal symptom. Okay, so what do you need? Good oral hygiene. Brush your teeth with soft toothbrush, flushing and using mouthwash. Okay, mouthwash is also very good. And if you have a forever tooth gel, it's also a kind of mouthwash. You just put a little in your mouth with some water and you gargle and allow it to stay in your mouth. Our forever toothpaste is one of the best that can handle this very, very well. Number 26 is feeling faint for no reason. If you experience lightheadedness of the way or feeling faint, it could also be due to the impact of your estrogen changes in your body or on your nervous system and your cardiovascular system. So get up slowly if you're feeling faint for no reason. Drink lots of water. Eat, reduce or stop sugary things, and move more from simple carbohydrates to complex carbohydrates. Then when you're lying or sitting down, make sure that you do so very gently. And another thing that could help you at this for feeling faint, to make sure you're not faint, is our bee pollen. Bee pollen is very, very good. Get enough sleep, avoid caffeine and alcohol, and limit your salt intake. Okay, then 27 is tingling in your extremities. Okay, it does not only feel weird like your hands, your feet, or that you're feeling asleep, but if it's persistent, check your blood sugar level. That's the first thing I ask women. Then they tell me about tingling sensation. I will ask them, what's your blood sugar level? Check your blood sugar level. Make sure it's okay. Then make sure that you're not lacking B12 or potassium or calcium. If you have calcium or potassium deficiency, you can have tingling of the feet. So what do? Get our B12 and get our nature main. Okay, nature main is far there. Get our B12 and your nature main. That will help you. And keep your weight in check. Eat balanced diet. Limit alcohol or stop alcohol. And make sure you see your doctor for the test I talked about. Number 28 is sensation of electrical stimulation or shock. You will just have one kind shock. Electric shock sensation. They call it ESS. It's a side effect of some women experiencing menopause. Okay, it feels like a rubber band snapping. Piam! A layer of tissue between your skin and your muscle, and this can also be felt on your head as if you're having hot flushes. Okay, so although that sensation is fleeting, it can still cause pain or discomfort to you, and because of this, they really don't know. Nobody has ever been able to say this is what causes it, but they feel it's because of the estrogen reduction and fluctuation in your system at that time. So what do? Number one, eat rich foods that are rich in cytostrogen. For example, light ultra is very, very good for cytostrogen. Light ultra mimics estrogen in our system. Take linseed, tofu, pumpkin seeds, sesame seeds, sunflower seeds. All these seeds are good. So what do I advise for people who are living abroad? Buy seeded bread. Seeded wheat whole grain bread can actually help you. Then reduce stress. If you reduce stress and you exercise regularly, it can actually also help. Increase allergies is another thing, is another symptom. You just find out that you're having one allergy or the other. It's either you're having bumps here, or you're beginning to sneeze, or you're, some allergic or new allergies or old allergies that you've had, they are coming back. Is another symptom of menopause. It can happen. Okay, so be careful about that. Honey will help you. Honey is very, very good in dealing with allergies. Number 30 is bleeding gum. More female hormones, that's estrogen and progesterone, cause more blood to flow in your gum, so which causes them to become more sensitive and overreact to anything that might irritate them. So women are more sensitive to the presence of bacteria, plaques in their gums, okay, because of that estrogen issue that they are having. So this can cause your gum to become more inflamed, swell, and then bleed. So what do? If you're having bleeding gum, it's a sign of poor dental health. Gum become inflamed and they bleed when there is a buildup of plaque along your gum. So make sure you brush your teeth twice a day, and make sure you use dental floss. Make sure you're using good toothpaste like Forever Tooth Gel, okay? Plaques is a sticky film containing bacteria that covers your gum or your tooth. And if you don't brush well, and I mean brush well, it's not that you don't brush, but you don't brush well. Practice the brushing style and use your brush. If you brush and your brush does not go in to remove some things from your teeth, change that brush. I'm telling you, the brush is not good for you. So 31 is discharge. During menopause, vaginal discharge and dryness are the two most common complaints. So with changes in your hormone level, this occurs during menopause. So people may actually experience a variety of symptoms, including vaginal discharge. What do? Eat a range of meals, including what is known as citrogenic food. I've already talked so much about it. If you don't know how to get it, get your Vitalize Women, get your Light Ultra. These are some of our supplements or our products that have phytoestrogen, okay? These two that I'm holding in my hand. Flaxseed, berries, carrots, apples, okay? Then the 32 symptom is dark circles. You have some people, you see dark circles on their eye like this. I really don't have it. So it's very common to notice changes in your skin during this our stage in life as a decline of estrogen level, okay? It's placed that because of collagen reduction also. Get your collagen, okay? With lowered collagen production, blood flow, cell turnover rates, and increased water loss, menopause often leads to thinning of your skin. So this can actually cause wrinkles, lines, dark circles to become pronounced. So, and it can also be caused by adrenaline exhaustion and thyroid dysfunction, but no amount of sleep can actually eliminate this. So what do? Still get enough sleep. Take your collagen supplement, very, very important. I've told us, I'm traveling, order for your collagen supplement so that your own will be among those that I will buy first hand, okay, and send immediately I arrive. Cut down on late night work and study. Stay hydrated. Water is very, very important. Cut down on salt, okay? Use the right facial cream. It's very, very important for you. And then cut down on alcohol and also drinking. Number 33 is increased tension in your muscles. This symptom demonstrates itself in those hunched up shoulders. You see some people, they are stiff like this. When they want to walk or when they want to talk, they are feeling uncomfortable. They are carrying their shoulder as if there's something happening to them. Or some of them, they are carrying their waist, okay, as if something is happening to them. These are all tension in the muscles. They are not really on the joints. They are in the muscles. So make sure you allow heat pack so that you can warm up, okay? When you apply heat to those tense muscle areas, it will help blood flow to flow better and help your muscles to relax. And our heat lotion is one of the things that can actually help you to do this. Heat lotion, if you apply and you massage with it, it will allow those heat and make you to relax. And absorbent D is also very good, or your calcium, very, very good, okay? Sunlight is also one of it. Number 34, I must finish before 1 hour. Painful or tender nipple. Non-cyclic breast pain is one common symptoms at this stage also, and this is caused by hormone imbalances. Sore nipples, cyclic breast pain is caused by hormonal changes, and it is primarily associated with the menstrual cycle for some women, but it can also come during menopause, puberty, pregnancy, and perimenopause. 35, and the last one, is cold extremities. Some people begin to feel cold in their tip of their fingers, tip of their toes. So some women in their 30s and 40s can actually suffer from this estrogen dominance, and when their body has a much higher level of estrogen than progesterone, they can now have all those cold extremities. So cold hands and feet are one of the symptoms of estrogen dominance, okay? And it sometimes feel quite strange, especially in the presence of hot flushes. You're feeling hot too, but you just find out that you're feeling hot, but those latter parts, those endy parts of your fingers and your toes are cold, yet you're feeling hot. These are the symptoms of menopause. Menopause is not an illness. It's a natural part of life. Though the symptoms may be difficult for us to deal with if you don't start on time, you need to do 4 things like I said last week. Eat the right diet. Right diet, very, very important. I've done a lot of videos on right diet. Watch my videos and do what you learn. Exercise. I take our Saturdays to exercise. Exercise are very, very important for us, okay? That's number 2. The third one is supplementation. I won't lie to you. If I come out here and I tell you no, all this food you're eating will be enough, I'm lying to you. You need supplement, because your supplement will help you, especially forever supplements. Chat me on my WhatsApp number. I'm selling them at a good promo price. My WhatsApp number is +234. I nearly forgot. +234 703 515 1642. +234 703 515 1642. That's my WhatsApp number. Okay, so chat me on my WhatsApp number, and you're going to be getting this product at a very good discount. You will not say you don't have money. There is affordable products that can help you. If you don't have money, chat me. We will discuss your issues, and I will tell you affordable products that can help you achieve your health goals without breaking your bank or your budget. I'm telling you about that, okay? So third is supplementation, and then the last but not the least is a good lifestyle. There are so many things we're doing that we're eating up ourselves that we don't have to eat up ourselves at this age. Good lifestyle can help you. Experiment with the tips that we have talked about today, and make sure that you live and enjoy your menopause. Menopause is to be enjoyed and not endured. One of the symptoms that I didn't mention, because I mentioned it last week, because by now you should be getting used to what you're doing about it, is reduced libido, not enjoying sex, and sexual enhancement reduce. You need it at this age. I talked about it last week. Get your aloe jelly. It's very, very helpful. Your royal jelly, absolutely, that can help you if you're having libido issues. Natural lubricants. Don't allow yourself to be injured from time to time. This is aloe vera, water soluble. It will help you. It's beside my bed. I've already ordered the ones they will go and collect for me on my trip. It's entering my bag. I use it on my hair, and I also use it just before sex. Very, very important, okay? And then take your royal jelly and your multi-marker. So I'm going to take our questions now, and we call it a day. If we don't have any questions, that would be good. You can chat me on my WhatsApp number and ask your questions. All right, okay, let me just greet the last people that came in. Gloria, Ernest, you're welcome. Grace, Udofia, Bolanle, you're welcome. Good evening, Bolanle. Princess Pa, Stella, Overseri, you're welcome. Femi, Emmanuel, Kami, Sola, thank you. Good evening, Kemi. How are you doing? Chibuza Dachuku, good evening. Chidimma, Uzoehelu, Lawal, Fumi, you're welcome. Anthony Uzochukwu, thank you. Comfort Uso, Okenwa Peter, you're welcome. Olajumoke Folashade, Ngozi Irabo, how are you, ma? It's been a while. Osai Glody, thank you all for joining me. I really appreciate you all. See you on Wednesday. We're going to be cooking. I told you, African food that can help us. And then I'm going to also show you. Will I show you that? No, I'll just do a video of that one I draw. Don't worry. Check my page tomorrow. You will see what I said. I'll do a video and just send tomorrow. Love you all.